Okay, so now we're going to move into these steps 2, 3, and 4 of pharmacokinetics. So after absorption occurs, the drug itself will then be distributed throughout the body. So that distribution is really the process of moving whatever the drug is throughout your body. And drug is obviously going to be circulated via the circulatory system. So you're going to take a pill. It eventually is going to get through your initial metabolism in the gut and the liver, and then it reaches the circulation through the portal vein. And that's when it's going to start to get distributed. So if you start out with 100 milligrams, you might end up with 50 milligrams that actually gets distributed. Or if you have an IV, the absorption is 100%. Bioavailability is 100%. Can't say that word, people. So then it gets distributed immediately. So the volume of distribution is actually the amount of drug in the body to the concentration of the drug in the blood or plasma. So once it gets absorbed and it starts to get distributed, we look at what the volume of distribution is of that drug. So as I indicated, you want the drug to be in the blood or the plasma. That's where you want it to be. Okay. If it gets into fat or extravascular spaces, that's actually not ideal. So your volume of distribution would not be considered very good. So we actually have like a nice little equation here. The volume of distribution equation is the total amount of a drug in the body divided by the drug blood concentration. So you want this number to be high. You want this number to be low. Okay, so if I can get things in my blood concentration, I can really distribute well. Okay, if it doesn't get there and it gets stuck in other places, that's not good. Okay, so essentially you want your volume of distribution to actually be a very low number because the denominator is hopefully very high. So the drug companies know this, drug manufacturers know this. So the dose required to give a certain blood plasma concentration is often determined by what we know this drug's VD to be. So it's not a real volume, it's more of like a reflection of how that drug will distribute through the body. And it depends on lots of things, the solubility of the drug, the charge, the size, etc. But we want the VD to actually be a very low number. Okay. Some other things that can affect distribution is the permeability of the tissue that you're targeting, and blood flow. So if your blood flow is diminished for some reason, obviously your distribution would be affected. Okay, so I take the pill, eventually it gets transformed a bit and eventually gets absorbed and then gets distributed into my circulation to hopefully where we want it to go. Okay, once that distribution occurs, the drug itself is going to start to be metabolized. Okay, that's a biotransformation that occurs. Metabolism actually can happen pretty early on if you take it pill form, but like if you take it IV form, it gets distributed in the circulation, but then it gets broken down. So your body eventually is going to take this active drug and break it down into an inactive substance that can be excreted. It has to be a water-soluble compound to be excreted. So your body's going to do a good job of breaking it down to make it in that water-soluble compound. Metabolism essentially primarily occurs in the liver. Okay, some will happen in the lungs, kidney, GI, epithelial tissue, but primarily it's going to actually happen in the liver. So some breaks down in the skin. So when you have like a transdermal patch, a little bit of it will be metabolized and biotransformed before it gets to the target tissue. But this is really a chemical reaction that our body does to help create this water-soluble or polar compound so it can be excreted. So a lot of pressure on the liver. You think about people who overdose or take drugs too frequently. There's really a lot of stress and strain on the liver because it's constantly metabolizing and breaking it down. The reason why the drug has to be broken down in the liver or other areas is because it has to get excreted, and it's going to be excreted through the kidneys. So the principal organ will be the kidney that basically will determine, is that a water-soluble compound? If it is, it goes out. If it's not, it'll send it back out to be broken down again. Okay, so the water-soluble then goes through the nephrons of the kidney and then out to the urethra and the ureters. The fat-soluble, they go right back to the liver. So this is like a really great visual, and I'm actually going to start here and kind of show you what happens to a drug if you start at by taking it in pill form. Okay, so the person's going to swallow this drug and you're going to see it go down into the gut, into the stomach. Part of it is going to be broken down and metabolized, remember that. And then it's going to kind of gradually start to be absorbed, okay? Then it's going to go into the liver. A little bit more of it's going to be broken down and metabolized. And then eventually it gets excreted into the circulation. So that's why we think if you take a pill, the bioavailability is never going to be 100%. So a lot of it's going to be broken down by the time it then gets into the circulation, and then it's going to the tissues, okay? Brain, muscle, wherever you want it to go. Now, you take another example. Here's an intravenous injection. I bypass all of that. All of that is bypassed. I go right into the circulation. It can go right to the sites I want it to go. Then you look at an intramuscular injection. If I want it to get to the muscle tissue, it's really helpful to go there first, and it gets absorbed there right away, and then also broken down, and then some of it will go into the circulation and then back to the target tissue. So this is a really effective technique, but it can kind of just give you a good sort of appreciation for the different routes of administration and how it impacts this whole process. A couple other terms here: drug half-life. The amount of time that it takes to eliminate half of the active elements of a drug from the body, to actually eliminate and clear it in the urine. So the amount of time that takes is determined, and we know for each drug. So if the drug has a really long half-life, you're probably going to have a long time until in your dosage period. So if it says take one in the morning and one in the evening, that might be because the drug half-life we know to be very large. Okay. When you're taking ibuprofen, it says every 4 to 6 hours. That's calculation based upon that drug's half-life. Okay. The longer the half-life, the longer your interval should be between dosage. Okay. But short half-life, then let's pop again in another 2 hours. Okay. And then now we're going to talk about drug categories. That's the next part of this this unit. We're going to talk a lot about sort of these main categories, the A's. Analgesics, your pain relievers. Okay. Anti-inflammatories, your NSAIDs. NSAIDs, by the way, are also going to be analgesics, but not all your analgesics will be anti-inflammatories. We'll talk about that. Antifungal to treat fungal infections, antibiotics to treat our bacterial infections, and then we'll talk about antipyretics as well. So this is our next sort of phase in this unit, and this is kind of just a summary of what we talked about. Pharmacodynamics are how they work. Pharmacokinetics are how they move throughout the body. And we're going to pick up next week talking about antibiotics. There's Kai. Let me know if you have any questions when I see you guys next time. Be prepared for some quiz questions.